Hello, everyone. My name is Mark Caldwell, and I'm with the Department of Human Services, and I work specifically in the Housing and Support Services Division, and I work explicitly on the Housing Stabilization Services Program. And today we're going to be talking about that very program. So we're going to do a very high-level overview of our services. We're going to talk about the impact that these services have on housing support. We're going to walk through a couple scenarios for property managers, and then we're going to just provide additional resources that will help you and people who are interested in this service get more information about it. But before we start this meeting today, I just wanted to go through a couple important items that you all should know about how you can best interact with myself and my other panelists. So first and foremost, this is being recorded. And then second, if you want to chat, make sure that you have that chat box open and that your chats are addressed to organizers and panelists. So what we'll try to do is at the end of each section break, I'll try to just open it up to questions. That's not to say that you shouldn't ask questions throughout, because we always want to make sure we capture those. And we'll do the best we can to answer those questions based on the panelists who are on today. Any questions we can't resolve, we'll definitely take back to our teams and try to work them out and get you an answer once we find one. So also keep in mind, just because of the nature of how we're doing this meeting, it may take a minute or two to determine who should answer the question. So that's just a setup for today's meeting. So today it is myself, Mark Caldwell, and then I also have with me Jeremy Galley. He's going to be working through the impact to housing support. And with that, we'll get started. So the main thing I really want to advocate for is how we're framing this conversation today and who is on the phone with us. So when I was asked to present, the MHFA team really talked about the need to focus on how our services, housing stabilization services, can really act as a way to do some big things in relation to the population that you serve through the properties that you manage. And three big areas I thought we could focus on today as part of the agenda would be, hey, how do we reduce potential turnover for tenants who may have housing instability in units that you have? How do you support tenant needs and wants in relation to their disability or disabling condition? And then how do you help tenants who need support to maintain their housing, but don't really currently have any housing related services such as housing support or those types of housing related services? And those are kind of some main objectives I thought we could work through today. And I also want to make sure that we provide a lot of time and space to really have you ask questions about how this service is going to interact with the types of services you currently provide at your properties. So what is housing stabilization services? The first part of this discussion today is to really focus on a better understanding of what the service is and how it connects to the tenants that you have. So first and foremost, it's a new Medicaid benefit that has been made available as of July 20th of this year. This benefit is dedicated to help people with disabilities and seniors find and keep housing. It is not a waiver, it is a state plan benefit. So what that means is if you meet certain criteria, you can access this service, and it does not require that you have a waiver case manager or any sort of case management service to get access to this. The goals of this service broadly are to support an individual's transition into housing, to increase their long-term stability, and through those two things, avoid future periods of homelessness or institutionalization. So those are the three big goals of this program. The services that make this program up are two major services and then a smaller one. And I know this is going to be a lot of information, so I will always kind of try to pause, and if there's questions or anything like that, feel free to ask. The first service is this transition. And what it really says is there's going to be people who provide help to help plan for, find, and move someone into housing. The other service, and this is the focus, I think, with the population that you serve, is you really want to support that person in maintaining living So what do they need to support them to maintain that living? The third little service at the bottom is called housing consultation. And what that is, it's a planning service because this service requires that everyone has a person-centered plan related to housing, that if someone doesn't have any sort of case manager, a waiver case manager or a targeted case manager, but they still need that plan developed, that a housing consultant can do that for them. So those are the two big services and one little service that's really specific to housing stabilization. Now what I'm going to work through is who would be eligible for this population. I want to talk about this in terms of the demographic that you serve. So when you think about properties you may manage or properties that need to be developed, the types of units that are going in there, this is something to consider in relation to our services. So in order to be eligible, you have to be on medical assistance, you have to be 18 years or older, and you have to meet these three big criteria. And what we're going to go through is how you meet the eligibility documentation, and then how all that might work as a process in the properties that you may manage or with the people that you may serve. So the first big thing you need to do, if you're working with someone or you know someone who may need this service, is how would you determine someone is disabled or has a disabling condition? So we use age blind or disabled as described under Title II of the Social Security Act, also applies to SSI or SSDI, and then people who've been determined by a medical professional to have any of the following conditions: long-term injury or illness, mental illness, developmental disabilities, learning disabilities, or substance use disorder. And that disability or disabling condition is broad. So if you imagine all the populations that may reside in units you have, think about, again, which of those conditions they may fall under. In this hard outlined blue box, these are ways we prove that disability. Because what's going to need to happen is if there are people that have units that are tenants that would be eligible for our service, they're going to need documentation that the state will need to see to prove that. So there's a couple of documentation types for proof of disability. So there's a professional statement of need. That's a specific document here at DHS, and it's also the document that's currently used for housing support. And we'll go into that in a little more detail. There's a medical opinion form. There's proof of receipt of SSI or SSDI. There's also the HUD 811 proof of disability form, which we have just recently approved as verified and usable. And then we're currently just working through other forms to make sure that they meet our criteria for our program. So that's the first one. Does someone have a disability or disabling condition? Second, do they have housing instability? So do they meet Minnesota's definition for homelessness or at risk of homelessness? Or are they currently transitioning or have recently transitioned from an institution or licensed or registered setting? Or are they eligible for waivers? So I hear a little feedback. If you are not muted, if you could mute yourself. Excellent. Thank you. So in the blue box, again, is how we always define the criteria, which in this case is housing instability. And what you'll see over and again in each of these criteria is that the professional statement of need becomes the document that kind of fulfills all three. And that's why we always advocate for it as kind of the primary pathway onto our services. But at the same time, we don't want to ever deny people access. So housing instability can also be met by a min choices assessment or long-term care consultation, or it can be met through the coordinated entry assessment process for people experiencing homelessness. And then last is this assessed need for service. So as a result of someone's disability or disabling condition, do they have a need for assistance in one of these four broad areas: communication, mobility, decision-making, or managing challenging behaviors? And again, the blue box indicates that there's really three primary documents that fulfill or show proof of that assessed need: the professional statement of need, that min choices assessment, or that coordinated entry. So that documentation piece is really going to be important as we talk further about process and how you may put those processes in place at the properties you manage or based on the tenants that you may have. So here's the professional statement of need, and it was in the lead up to this meeting, it was really advocated that we work through this document and really talk about why it's so useful and important in relation to the population you may serve. So we have this professional statement of need. I hyperlinked this, but you can go into eDocs and search it in our eDocs repository at DHS, and if you type in 7122, you'll find it. And it is a form that is used by qualified professionals to confirm that a person meets criteria for housing support and/or housing stabilization services. And I just want to put this in there because it's not on here. In order to meet housing support, it could be someone from the county, but in order to meet housing stabilization services, it would actually need to be a qualified professional. So that's just a caveat I want to put in there. So something that may occur is you may have people who are assisting tenants you have, and one thing that may occur in that assistance is you may ask them, who do they have helping them in their lives that could get them a professional statement of need? And this could be a doctor or a psychologist, or if they're working with a waiver or targeted case manager, that would be a really great first step to get them towards that eligibility for our service. Because if you can get them connected to their doctor or their case manager who's a qualified professional and could sign this document, that one document would really be all that you would need to show you're eligible for the program. And then one of the things to always consider in kind of that outreach to people who are your tenants is that our service, you always have to update this annually. So that professional statement of need would need to be updated annually, and that might be something as you have staff who work with tenants that you would want to ask on an annual basis just to make sure that that documentation is getting updated. So this slide shows one section of the professional statement of need, and the reason I showed it is because a lot of time we ask, who are the qualified professionals who could sign this documentation? And I thought it was really important to kind of see each of the disabling conditions and then see the types of qualified professionals that would be working with people that you serve. So then as you do outreach to tenants, then you may be a little more cued in to ask certain types of professions that people may be working with that could lead them directly to a professional statement of need and someone qualified who actually could sign that. So this is a really good document to kind of show disabling conditions and those qualified professionals who would be able to sign this document in totality. So I don't see any questions yet. If you have questions, please ask them. I know it's a lot to take on, and even if you come back, we have an email that you can contact us even later. Please feel free. But I'll keep going with the presentation, but if there are questions, please put them in the chat as we go. Our program, Housing Stabilization Services, is a home and community-based service. And as a result of that, there's these important requirements that should be kept in mind in order to really fulfill what those standards are in our program. So first and foremost, everyone receiving housing stabilization services needs to have a person-centered plan. That is that planning process that if someone has a waiver case manager or targeted case manager, they would do that. If they don't, they would have a housing consultant. But it really needs to be driven by that individual. It needs to include their strengths and interests and wants, as well as what supports they need. And it really is about helping make an informed choice about who their provider should be. So that's another component about thinking about how these services could be integrated into properties and tenants that you have, is if someone is you think is eligible, or you're working with people who could be eligible, they need to really be informed about who their potential providers are in the area, and that they get to make a decision about who that would actually be. So something, again, when thinking about process and flow, and if you're you have staff who are working with tenants on other housing-related services or services in general, just to keep in mind, is if you're working with someone and they have a waiver case manager, you would refer them and back to that waiver case manager and tell them you should have them work with you on getting access to housing stabilization. And in doing so, they would update what's called a coordinated services and supports plan. Additionally, if someone has a targeted case manager, they would update a housing-focused person-centered plan, or if someone has a senior care coordinator, they would update the coordinated care plan. And as I've said before, if people who do not have a Medicaid-funded case manager, they don't really have access to services generally through that area of waiver case management, they would use a housing consultant. So again, it's just really to keep in mind who you could tell your tenants or people you might be working with who to do outreach with, that they're already helping them get access to services. Okay. So I want to take all the information we've walked through and just kind of give a visual flow. And then this flow will also be represented in the scenario, so then we can see the process and how that process, again, might be integrated into pre-existing processes that you all have at properties. So first and foremost, someone needs to have an assessment. What type of assessment might you do? A professional statement of need, qualified professional. They may have a min-choices assessment or LTCC. This often occurs if someone has like a waiver case manager, or they might have gone through the coordinated entry. And again, this is often for people who are experiencing homelessness. So that's the assessment. Once they have the assessment, they need to have a plan. I just went through those different types of plans. There's a housing-focused person-centered plan. If someone has a housing consultant or targeted case manager, there's a coordinated service and support plan if someone has a waiver case manager, and then there's a coordinated care plan if someone has a senior care coordinator. Once all that occurs, it is always the housing stabilization service provider, the enrolled provider who will actually be doing the service, who submits all the documentation. And that documentation gets submitted to our state-run eligibility review system. Anybody familiar with services in the past? This is not a service agreement. There is no service agreement with the county. In lieu of that, it's this eligibility review system, which is pretty much an online submission system, and we're the ones reviewing that information. So this service provider submits the assessment, the plan, and any sort of that documentation of disability or disabling condition, and then our staff review it, and they either approve it or deny it based on certain conditions. And what I'll say is we already have over 500 people who have been approved for our service, and we've only been doing this for 3 months. And that's a really good feeling to know that the system and the eligibility review staff are actually working to make sure people get access to our service. So now that person's approved, the provider can actually start working with them and they can start billing. And we've actually already had providers be able to bill for our services. So the system's working. I'm going to pause here and just answer one question is how do you find a housing consultant? That's a really great question that we have a lot. Currently, we have a provider directory that you can search that information in, and I'll talk about that when we get to the additional resources section, because it's the directory that you can search to see who's providing housing consultation and who's providing transition or sustaining services in your area. Okay, so we've worked through broad overview of the program, how you may be found eligible in terms of the documentation you need, in terms of who you might work with, and that kind of flow. And now what I want to work through is the settings requirements, because this service goes with the person, and the person has to be living in a setting that is meets the home and community-based service requirements. So I think this is a really good thing to keep in mind when you think about providers who may be providing services on site through the property directly versus external service providers who may come on site to work with you. So a person must be living in or planning to transition to a setting that is integrated in and supports full access to the greater community, protects the rights of privacy, dignity, and respect, and freedom from coercion, optimize autonomy and independence to make life choices, and choice in services and supports to those who provide them. Additionally, there are provider-controlled setting requirements that are in addition to these. So a person must have a lease or lease equivalent. Each individual has privacy in their sleeping or living unit. Individuals have the freedom and support to control their own schedules and activities and have access to food at any time. Individuals are able to have visitors of their choosing at any time, and the setting is physically accessible to the individual. And at the end of this in our resources, we have an HCBS settings hyperlink that really gives more detail about these requirements and then which settings would be allowable under this. So I think that's another thing to keep in mind about service provision is, do the properties you maintain meet home and community-based service settings requirements? Okay. So I'm going to work through other services. And again, if you're not familiar with that, that's okay. It's just important information that everyone should know about our program and how our program is just one of a number of housing-related service programs that people have access to, and that sometimes they're duplicative and other times they're not. But what we always want to advocate for is people having access to as many services as they can that supports them in their housing or helps them find stable housing. So our housing stabilization service duplicates housing access coordination in the 1915C waiver. So what's happening is people are already transitioning from housing access coordination onto our services, and typically that happens at their annual renewal with their waiver case manager. Additionally, people won't be allowed to receive our services while they're also receiving relocation service coordination, a certificate of community treatment, or Moving Home Minnesota. So that's more just in the nuances of how our services work with others that are currently existing. What's really nice is that our services do not duplicate certain services, and therefore a person can be receiving both, and you can even have providers who are doing both as long as they document their time to indicate when they're doing one versus when they're doing the other. So a person can have a targeted case manager. They can be receiving ARMs, semi-independent living services, behavioral health homes, or even healthcare care coordination, and our services at the same time. Additionally, people can be receiving money from housing-related grant programs and our services. So what happens is it's always important that you document when one is occurring, or if there's something that that grant program covers that our services won't. We often point to support with chemical dependency recovery, employment services, the cost of moving. Our services don't pay for actually deposits or furnishings. So if there's programs that support those types of things, that could be supplementary to housing stabilization. And then I'm going to conclude this section with a big topic, which is one of the home and community-based service requirements is a conflict of interest requirement. And this is really something we've heard a lot about, and we've had a good amount of discussion with stakeholders and providers around, because it becomes a challenge for some providers who are used to both doing the planning and also providing services to people. And so I just really want to spell out what this conflict of interest means, and then what's occurring because of COVID, and then some exceptions that are in place. So there's a big blue line. That line indicates that if you are a housing stabilization service provider, you cannot do the assessment and plan and also the transition or sustaining services for the same person. That doesn't mean you can't do both housing consultation and transition sustaining. You just can't do it for the same person. So if you have someone and you have a housing consultant and they do that plan, they cannot then be the transition or sustaining provider for that person. Under COVID, because COVID is a federal public health emergency, what will happen is that this conflict of interest is waived. So this federal public health emergency is set to expire on October 24th, and we are still waiting to see if that will be renewed again. But until then, if you are a housing stabilization service provider, you can do both the planning and the transition sustaining services for the same person. Always keeping in mind that once that exception is up, once that federal public health emergency is over, that you will have to abide by the standards previous to that. There are two exceptions. So there are two ways that providers can waive that conflict of interest and provide assessment and planning and transition or sustaining services to the same person. The first is if they're a provider in a geographic shortage area. So those geographic shortage areas have been defined and they're available on our website, and they are based on county. So there are certain counties throughout the state that we have deemed shortage areas, which means there are not enough providers to do both services. And if you are a provider in that county, what you would do is you'd submit a form that says, I'm an organization in this county, and therefore I can waive that conflict of interest and do both assessment and planning and transition sustaining services for the same person that I'm serving. So that's one way you can waive that exception. The second way you can waive that exception is if you are serving a culturally specific or language specific population. So first and foremost, if you're a tribe or serving tribal members, that would be an indication of cultural specificity, and you would be able to waive that exception. Second, we always want to promote the idea that there are common languages, also deaf and hard of hearing, and other ways that cultures find that allows people to serve a population that's specific and has specific cultural needs. And you would just have to demonstrate that documentation when you submit that form. So those are two big areas that would allow a provider to essentially waive that exception process. I have gotten to the end of my section, and I just want to end and kind of answer some questions. So all the hyperlinks in our presentation today can be found if you go to hb101.org under the Partners tab. We've actually done some road shows throughout the state, and those slides have all of the links that are available. I can also make sure before we end today to get some of those links into the chat function so you can get some of those. So I just want to make sure, Nikki and others, when you're asking about that, we can get some of those links in for you. Jeremy, I was wondering if you could help me with a question from Gary Travis about just clarifying owned and provider controlled settings.
Hi, this is Jeremy. Thanks, Mark. That's a good question, and I don't think I have a super good answer other than I know it when I see it usually. So I don't know what the technical, I don't know if I'm going to be a lot of help because I don't know if I know the technical definition, but I think actually somebody is chiming in here.
Okay.
So for the housing stabilization, I think it would basically be that it's about the MA service provider being in place and for us, that would, I guess that's really, I think that's really kind of the same definition for us too, thinking through it here. It's when it's not having an ownership. It's not about, it's about who's involved in the service provision. Maybe Gary might want to unmute himself because Gary might be able to talk about this better than I can. So
yeah, and that's where I went, Jeremy. I think that's a very challenging one to work through. So, and we could unmute Gary. I know he's on the line. Why don't we work through that? And if Gary wants to chime in, he can, and then I'll just try to answer some more questions before we move on. So, Isaac, you asked at 128 for counties that only have one organization. Is that you, Gary? Okay. So Isaac asked at 128 for counties that only have one organization serving it, are there any exceptions to this rule? So Isaac, if it is a county that's a shortage area, and we've really tried to take into account a lot of different aspects of shortages of qualified professionals. So if you are in Steele County, for example, which is a shortage area, that would be an exception. If you're in a county that is only one organization and it's not an exception, it would not, you'd still have to abide by that conflict of interest standards. Something to keep in mind too is this is a brand new program and we just started 3 months ago, and we're really going to intensively look every 6 months at our provider pool and the geographic distribution of that to see if we need to expand the number of counties that may become shortage areas based on just the provider spread throughout the state. So thanks for that question, Isaac. We'll make sure we get the posts up. I'm going to let Amber asked at 1:30, can someone be in both housing support and then also housing stabilization services? Yes, Amber, and I'm going to let Jeremy he's going to speak more to that in his slides coming up after this. And then Amber asked again at 1:30, when you talk about duplicates and say provider, do you mean individual person providing the services, or provider meaning the agency as a whole? For example, could the targeted case manager and the housing stabilization service be provided by the same agency? Great question. When we talk about provider, we're talking at the agency level. So to your question, if they are not fulfilling one of those exceptions, if they're not in a geographic area or serving a cultural or language specific population, you could not have someone have targeted case management and also housing stabilization as long as if they're in the same agency. So that's something we've had a lot of work with targeted case managers in working with them, because that is an issue we see where often people utilize the same organization for services. So we appreciate the question, Amber. Okay, so Dawn, great question. Dawn asked at 1:32, can you talk a little bit more about what sustaining services entail, and also for someone with very significant support needs, how much of this service can they get? So thanks for asking that question, Dawn. So if you are found eligible for the program, a person gets 150 hours of transition and 150 hours of sustaining services annually. And we pay a rate of $17.17 per 15-minute unit, or $68 an hour. So it ends up being about $10,000 that you can bill a provider per person per year. The sustaining service is really all about working with them to keep them from becoming housing unstable. And as we've talked about in the training that we provide, some of it might have to do with reasonable accommodations and working with them to make sure that they have those. I might be working on barriers that they're trying to address. So those could be overt barriers like a history of evictions or low credit history and trying to establish better credit, working on criminal expungement, or it might be underlying barriers that they see as a result of racial bias or gender bias, and you being really an advocate for them to really make sure that they feel comfortable where they live, and then if they want to stay there, that you're working with landlords and property managers or roommates and really clarifying what the issues are and how to resolve them. Additionally, Dawn, if there's people who have really significant needs, if you're providing sustaining or transition services, you can ask for an additional 150 hours for that person because you feel like they have more barriers than that initial 150 hours could meet. So you submit an exception request through our website and you indicate, hey, here's some areas that they need, the reason they need more hours, and then we review it, and then if approved, you can provide another 150 hours for that person for sustaining services.
Hello.
Hello, is this Gary?
Yes, it is.
Hey, Gary, we were wondering if you could, I know you asked the question, but maybe you could be your own person to answer it, to really clarify owned versus provider-controlled settings for the attendees.
Sure. The question is really around agencies that are performing a property management function in one area of the agency and is doing a service function in another area of the agency, but the services aren't provider controlled. Person has the opportunity to decline either the housing or the service. And I'm wondering how that distinction might be made within the application process, enrollment process.
Yeah, so in the application process, it would have to be based on the site that is enrolling. So it would be, I guess there's a couple nuances to this, right? So if you're an external service provider, you would enroll whatever your business location is because you're coming onto the property to provide services. I think the more challenging question is if the services are provided on site as part of the property, how would that distinction go? Is that kind of where your question's going, Gary?
Yes.
Okay. And I think that's one we're currently working through with our provider enrollment to really clarify that, because that's some questions we've had as properties that have services are trying to enroll. So that's just something we're still working on in terms of getting a explicit answer for you. Right now, it's very nuanced just on who's enrolling.
Okay, thank you.
You're welcome. Yeah, and more to come with that, Gary. So I'm just gonna have one more question, and then I'm gonna let Jeremy take over so he can kind of talk about the impact to housing. But something that Lisa asked at 136 is, she said, what is the site manager's responsibility in getting residents signed up for this service? And I think that's a really great question that I want to be a question that we kind of work through today, and I'll provide some ideas, and then we can maybe ask questions and work through what is that responsibility in the context of the tenants that you have. So we'll make sure we address that after Jeremy works through his discussion on the impact to housing support. And with that, I'll hand it over to Jeremy Galley, who's going to talk about the housing support program.
Thank you very much. I appreciate it, and thank you, Gary, for chiming in to help. You, when I see you asking a question, I usually know Gary has like a really good answer for this, and you are one of the experts that I rely on. So thank you very much for jumping in to help us on that one. I appreciate it. So I'm here to talk about how the availability of housing stabilization services will impact the housing support program. So up to now, most of you know where housing support or supportive housing for housing support exists, it's been pretty connected to LTH supportive housing, maybe some limited other opportunities where we use some other service rate capacity. There are, some places that don't have services connected with the room and board, but maybe they have, and maybe have some other services that are in the picture, maybe TCM, but it's largely been for the supportive housing developments connected with, or where housing support is used, it's largely connected with LTH supportive housing. So housing stabilization services really creates an opportunity for, I guess the way that I think of this is that it really creates an opportunity for more people to get the supportive services that they need using a really similar eligibility criteria. That's what's powerful about this, is the eligibility, as Mark pointed out a couple of times, looking at the professional statement of need. The eligibility for the two programs is very similar, and so we're opening up a broader bucket of services to support people without having to necessarily use housing support to pay for their housing costs. So that's one of the things that's really exciting to me, is it actually ends up putting a person a little bit closer to being in the center in terms of their ability to kind of choose what their path looks like. And to have more options to be able to piece together their housing and their services. There's a whole lot of nuance to that, because it really, honestly, it always ends up being a discussion about what works for an individual person. And I think this actually gets one step closer to that. So now people can use a number of different ways to pay for housing and have the service resource in place. They might be able to pay for housing on their own and still get some supportive services if they need it. They might be able to use another subsidy if it becomes available, or other types of rental assistance that maybe are targeted to a specific group of people, and maybe they can partner that together with housing stabilization services. Maybe it's somebody who's already living in a project who's not part of the number that you've carved out for using housing support, or using MSA housing assistance. Maybe it's just a person who's a private pay person who happens to still be on MA, and maybe they need some of these supports. So there's lots of different ways that a person could end up on these services. Sometimes it'll be an intentional effort to say this is our target group, and sometimes it'll just be incidental, like, oh, there's a service that I know about now that I can provide for people that are having some housing instability or potential housing instability in my in the development that you're providing services in or that you're engaged with. So, again, and I always like to just think or point back at mainstream services are always available for anybody who's eligible for them. So housing support is an example. You have to have if you're a housing support provider, or to be a housing support provider, you have to have an agreement. Sometimes it comes with services, sometimes without services. But this will also, housing stabilization services will also partner together with housing support with or without the room and board in place, with the supplemental services in place. And I'll talk in detail a little bit more about that in just a minute. But it also really works together with MSA housing assistance. And I probably is going to come up later, but it's really important to just think about how this, not just people that are private paying, not just the traditional world of housing support, not just people that have rental assistance, but also people who have SSI, and maybe they're moving on from housing support. And now, because we have the housing stabilization services, a person can say, you know what, what works better for me is to move into MSA housing assistance. I'm going to have that money go to me. I'm going to take care of my own housing costs. And incidentally, or by the way, the housing stabilization services has a bigger benefit, and that transition from housing support is now in itself an eligibility category for MSA housing assistance. So just keep in mind, I don't have any slides about this right now, but just to sort of like set the context for this, that mainstream resources can work together really well. In addition to people paying for their own housing or having rental assistance, other mainstream resources can partner together really well with housing stabilization services for anybody who's eligible. So it's a bigger bucket and an easier bucket to access for people, even though people their specific pathways. It's so broad in terms of who we're able to catch in this world. And I think I just want to make sure that's not lost on people, that this is a game-changing moment in terms of what's available to pay for services for people. And we're the first state in the country to have this. So it's a super exciting moment to be able to say, hey, we have this new resource that we can figure out. There's going to be growing pains. There's going to be ways that people need to figure out how to make it work. But it's just really important to know that that this is a big moment. So anyways, enough of my cheerleading. So bottom line, for providers, thinking about messaging, planning, access to benefits for people, understanding where those moments are to recognize when a person might need some supportive services, or in your specific outreach to priority populations, to figure out how people will access the new stabilization services. And then also letting us know if you have technical assistance needs. Because that's where we're at, is we want to support providers as they start to bring this in. It's new, it's not always super easy. So we want to be able to partner with you. And as you'll see, that we referenced this a couple times, that we really want to work together if you've got questions about how to make this work. For developers, I want to just, if there's any developers that are listening in today that are thinking about future proposals, thinking about how you might make this work, it's really important to know that what this is another tool in your toolbox to really be able to demonstrate for Minnesota Housing how you meet their priorities. So it is not something to just leave as an incidental, like, oh, there's a new service that's out there. It's really something that can be incorporated into specific development plans that serves a broader ability for the providers that you work with to be able to serve the people that are priority populations for Minnesota Housing. So just side note about that. So Mark, if you want to kick into the next slide, I'm going to just kind of dive into the actual direct impact on the housing support program. It's really important to think about how things will change over the next little while. But to understand what will change, it's important to think about how we got to this spot. So back in 2017, when the housing stabilization services were sort of just in the beginning stages of an idea, with our state legislature, one of the questions that the legislature had was really looking at, where is there, we have this other service called housing support. Where's there duplication between those two? because the services look, at least a slice of them look really similar. And really the end result of that conversation was that, yeah, there is some duplication, and the estimated duplication is about 50%. So that because there is some duplication, the part of the legislation to authorize the new housing stabilization services required a reduction where there is some duplication on the housing support side. So housing support providers that are in specific categories. This is not across the board. It's really important to know that this is not an across the board reduction for housing support supplemental service rate providers, or some of you might know them as rate 2. We don't really use that terminology very much anymore, but that is who we're talking about, is those that get the services on top of the room and board. There is not an across the board reduction for all supplemental service rate categories. But starting in July 2021, 3 different categories of housing support providers will have a supplemental service rate reduction of 50%. And that's very specifically the long-term homeless supportive housing. I already mentioned that that's kind of been the go-to for a lot of development projects. So where that exists, there will be a 50% reduction. And there's a small-ish program in the metro area called the Metro Demonstration Project that is also duplicative, and that's also included in the legislation. And then the last category is the housing with services independent living category of housing support. Not assisted living, because there's, right now there's housing with services. That's actually going to go away. So we don't expect to have very many providers that are in this category that will be impacted, because most everybody who is in the housing with services registration category, if they're providing some assisted living services, they will by August of next year have to go into the housing or the new assisted living license. And those that are in that category that aren't assisted living, they will go into what's called our supportive housing category, which is not impacted. So any providers that are in the supportive housing category that have supplemental service rates that are not based on a person's long-term homelessness, those will not be impacted by the rate reduction, as long as the provider is not in the housing with services category anymore, which will be literally only possible for about a month, because that category in itself is completely going away. So enough about that. I don't need to get too far in the weeds, but let us know if you have questions about that. We will help you figure out if you have an impact or not. The important part to know is that if you're in one of those categories, the reduction does not depend on whether you decide as a provider, if you decide to enroll in the new as a housing stabilization services provider or not. It's categorical for those 3 categories. Mark, you can go ahead and kick to the next slide. So this is, Mark showed the clip from the professional statement of need earlier for the housing stabilization services and who can sign off on disabilities. And we have our own section on the professional statement of need that's very specific to the housing support supplemental services. And this is, the qualified professional or the county designee can indicate what supports a person needs, and people need to have at least 2 of these to be able to get the supplemental service rate if the person's in a place where the supplemental service rate is available. And you can see in that first bullet point, there's a ton of duplication between housing support, tenancy supports, that first bullet point there, and the new Medicaid housing stabilization services. So that's where you'll see most of the duplication. And you can see that some of the other categories don't have quite as much, because housing support actually pays for some services in our supplemental service rate that housing stabilization doesn't cover, like employment supports, maybe some health supervision kind of stuff, maybe some basic, some real basic things like with accessing public benefits. That's something that we actually, on the housing support side, do pay for as a supportive service to help people stay engaged with their public benefits. One of which is the new Medicaid housing stabilization services. So helping providers helping a person access and maintain their MA and maintain their housing stabilization services is in itself a service that's covered under the housing support supplemental service rate. So you can see how it's possible to do both at the same time, but it's really important to know that there is some duplication. So it really comes down to documentation, and that's something I think we'll cover here on the next slide in a little bit more detail. when we talk about what's not changing. So what's not changing for housing support is our room and board rates. There's no change in our room and board rates. They are not impacted by the rate reduction at all. Those are calculated and determined separate from the rate reduction, and even in general, they're calculated separately from the room and board, from the supplemental service rate. So no change to the room and board rates. Billing, if you're a supplemental service rate, if you're a housing support supplemental service rate provider, you're still going to bill in minutes, and you'll bill alongside the new Medicaid housing stabilization services. And we'll get into the documentation piece in just a second. But the billing process for the housing support supplemental service rate will not change. It'll still be in minutes. The service standards are not changing. So on that professional statement of need that I showed a minute ago, what we require is that people get connected to those services that are identified on the professional statement of need, and that those get documented. So this is the part where talking about documentation is really the part where it's important to talk about how these can coexist, how the two services can coexist. And it's not something that that we need to necessarily get really super deep in detail about at the moment today, but just know that the case notes are required for both. Case notes are definitely required for housing support, and it's okay for the housing support and the housing stabilization service documentation to exist within the same system. Doesn't have to be in an electronic health record system. They can be in the same system as long as the activities that you're documenting can be reported separately, and that when you're providing which service. So it'll be important to think through over the next year, as for housing support providers, to think through, okay, how do I demonstrate that I'm providing housing stabilization? And we want you to be in that world. We want housing support providers to be housing stabilization services providers. So we want you to be thinking, how can I document that I'm providing, or when should I document that I'm providing housing stabilization service activities, and when should I document that I'm providing housing support activities? And we can help you sort through that if you need to. And the last section here is just to talk about what in the world should I be doing as a housing support provider, or if you are not a housing support provider and you're engaging with a housing support provider about some unknowns that they're not quite sure what to do over the next year or period. First, we want you to assume that you should be in this world, because it is better funding, and it is, or for most providers, it'll be better funding than the housing support supplemental service rate. And we want providers to enroll sooner rather than later. So not waiting until next year. Don't wait until 2 months before the rate reduction. This is prime time. This year, as this is rolling on, this is the year to learn this and figure out where it works, where it doesn't work, what limitations you'll have, what programmatically you need to do to be able to make this work. So use this time to really develop those processes and develop some partnerships. I think Mark is going to talk later about some of the local partnerships. This is because of needing to have the separation for the assessment and the service provision for people. It'll be really important to have some understanding of what partnerships need to be developed, and then to follow through with figuring out, okay, who do we need to get to know in our area where we can work together on making this all work, including some things like billing. Maybe there's smaller agencies that don't have the capacity to do billing all by themselves. Maybe you work together to do billing all together, or maybe you hire an outside agency on a contract, or however that works. But this is the moment to do that. It's not. I just really strongly suggest for housing support providers not to wait until next year. And again, let us know if you have questions, if you need technical assistance. Everybody knows everybody's super busy right now, so we are too. But that doesn't mean that we don't want to hear from you, and we don't want to figure out how we can get together and try and carve out some time to be able to work on some technical assistance to help you figure out how this fits. So let us know if you've got questions, and I'll leave it at that for now. But I appreciate the opportunity to talk about this. And this is, again, I just want to say this is really it is a new service, but it's a big new service that really is going to create a way for us to provide services to the same group of people where we struggled to get all the funding that we need. They're eligible for this service. So just keep that in mind as you're thinking through and planning developments. Thanks, and that's all I have for now. And I'll mute myself here, and we'll wait for some questions.
Excellent. Really appreciate you coming on today, Jeremy, working through how housing support is really just going to work really well with this new service and the ways we complement them to really make sure people get the housing support they need. So a couple questions came in specifically for you. One was just from Phoebe at 151, and she said, we're just really interested in getting that technical assistance. So they're providing some independent living services, but won't be under the new assisted living license. So Jeremy, Phoebe, get in touch with each other, start working together on that. I have a question for you,
Phoebe,
Jeremy. Go ahead.
Just real quick, Phoebe, if you send an email, I'm not sure what emails you have at the end of this, Mark, but if you get in touch with the Housing Stabilization Services team to get to me, they'll get me the email from you. If you send something to say, hey, we need to talk, let's do it.
Excellent. Thanks, Jeremy. And then we had a question from Amber at 150. Is the reduction in July of 2021 only for individuals that are officially receiving housing stabilization and housing support, or for all supplemental service rates for anyone receiving housing?
Yeah, that's a great question. So the rate reduction in July of 2021 is based on a person being eligible for the new housing stabilization service. So if you're, and if you as a provider, this reduction is about providers and all the people that they serve that are eligible for MA. So because what the legislation required is, hey, if you're in this new category of service, or if people are eligible for this new category of service, they have another place to go that will or another pathway to services to support them. That not all of which is duplicative of housing support. So July 2021, it's categorical for providers, and for every person that you're serving that gets a supplemental service rate in that category, there will be a rate reduction. So the fundamental question is for providers: am I an impacted provider? Am I a provider that is in one of those three categories? And just to refresh, it's long-term homeless supportive housing. So if you're not long-term homeless supportive housing, you're not Metro Demo, which most providers aren't. And that third category of the housing with services independent, or the housing with services registration, that's pretty much going away. So presumably it's really just LTH supportive housing functionally. So the biggest impact is in LTH supportive housing. So if you are an LTH supportive housing provider, you're probably going to have an impact. That does not mean, and it's really important to know, that does not mean that you're taking that's you might be getting referrals from coordinated entry and not be impacted, because the lens for if you are LTH supportive housing is the lens from DHS, not from Minnesota Housing, because Minnesota Housing might say you might have agreed as a provider, or as a housing provider, to take certain referrals from coordinated entry. Those might be high priority homeless. They might get services from them even, but they might be outside of our programmatic window or programmatic lens of LTH supportive housing. And those will not receive a rate reduction. The rate reduction is only for those that are specifically in LTH supportive housing. So let us know if you have questions about that. But it is a nuanced point, but it's really important for you to get a solid answer about whether you will or won't have an impact. So please let us know if you're not sure, if you don't know if you're going to have an impact or not. Let us know, and I will help you figure it out, because we really want people to go over the next year making plans based on correct assumptions. So let us know if it's not clear. Thanks for the great question, Amber.
And then we just have one more question for you, Jeremy, before we move on. So from 146, a question was asked. We have people on our housing wait list for scattered site services, but we have a limited amount of housing support to enroll households. Can we now enroll more people in housing support plus housing stabilization, or will we still be limited in the number we can enroll in housing supports regardless of HSS enrollment?
Yeah, that's a really, really great question. Love it. So you are only limited by what your housing support agreement allows you to do. And you might have to tweak what your housing support agreement looks like between you and the county or tribe that you're working with. So you, for example, if I am a long-term homeless supportive housing provider in Hennepin County, or let's say I'm a housing with service, or I'm a supportive housing provider with no long-term homeless requirement, and maybe I'm getting some service funding, and my agreement says I can serve 10 people. The agreement is what is primary. So whatever your agreement says with the county or tribe, that's what determines your capacity. But if you have an agreement that grows and allows you to serve more people, that agreement may assume, based on your conversations with the county or tribal staff that you work with, it may assume that you're only going to be doing room and board, and you'll be providing housing stabilization services to provide services to support people, and they might be using housing support to pay for their room and board. So that question really is best asked. We can help from a technical standpoint to help you figure that out, but the actual authority for that exists within the housing support agreement you have with your county or tribe.
Excellent. Glad you're here today, Jeremy. You can answer those good questions. And then we're just going to answer one question from. Go ahead, Jeremy.
Oh, that's it. I'm reading in the next question here.
Yeah. So we're just going to answer one from Peter, and then we'll go on to our scenarios. So, does participation in long-term homeless, high-priority homeless, I think it's
housing
support program, stably housed suffice?
Oh, yeah, that's right. Yeah,
is that correct?
Yeah.
Suffice as a demonstration of housing instability. So, Peter, what I'd say is housing instability is met by that documentation of either having a professional statement of need, they've gone through min choices or long-term care consultation, or they've had a coordinated entry assessment. What will happen is if someone's on housing support, they will have a professional statement of need. And the newest professional statement of need now has a section dedicated just to housing stabilization service that a qualified professional could essentially sign. So just because you're in housing support doesn't necessarily you're automatically showing housing instability documentation for our program. You'd still need to have that professional statement of need updated with our section signed by a qualified professional. And is there anything you wanted to add, Jeremy?
I would just add that the presumption is that most people who are in supportive housing have a history of housing instability, so there won't be an issue with getting the documentation to demonstrate that.
Excellent.
So they're in supportive housing for a reason.
Yeah. Good point.
Maybe a good short way to say that maybe would be it's not automatic, but it's presumed that most people would probably be eligible. They don't have to experience more housing instability to be able to get turned on for the new service.
Correct. Yes, and we wouldn't expect that. And then Peter, just the coordinated entry completion has to be recent because we actually have questions that are specific to that assessment that we've just actually put in due to our launch. So anybody who's received a coordinated entry assessment after July 20th of this year, that would be valid because then they've been asked questions and there's an assessment document that comes from those responses. So to your question, Peter, if someone had a coordinated entry assessment, they would have to have that assessment updated unless they had it after July 20th of this year. Okay.
And thank you so much. I think that's an important distinction. That's an important distinction too, that it's not a cutoff for the person to not have access, because local coordinated entry systems can build in a plan for and are building in plans for how to accomplish this how to get that question answered for people. It doesn't always have to be only a person coming into coordinated entry from the outside and waiting. That this is not just for people who are just now engaging with coordinated entry. It can happen just as an administrative function of the coordinated entry system.
Yeah, I think that's a really good point, especially for so many people who are on wait lists who very much need this service. Excellent. Thanks, Jeremy, and to those of you who asked the good questions. I'm going to work through just some scenarios for property managers. And again, this is from what little as much as I know about how this works, but it always helps to have you all clarify or ask good questions so we can make sense of it together, because I have a limited understanding of some of the things you have in your world and vice versa. So I created 3 kind of broad scenarios, and I just wanted to work through them visually. And if there's questions or if there's things that don't make sense, or that you're saying this isn't how the operations go or how your process works, let us know in the chat, because way up to Lisa's question, what is the role of site managers? We're not prescriptive. We want this service to be accessible to everyone. We also understand that it may take capacity and resources, and we want to try to make it work for people who would be getting access to the services, providers, and the people who really need this. So I'm going to work through 3 scenarios. The first scenario is if the person has a MA-funded waiver case manager, and what that means is, do they have a targeted case manager or do they have a waiver-funded case manager? So what you would do is essentially point that person, again, I don't know what site managers often do in terms of outreach to tenants, but you could very much have that person work with their waiver case manager and say, hey, next time you meet with them or talk to them, indicate that you're interested in these services. And then that handoff could occur where then the waiver case manager updates their Min Choices assessment. Then through that assessment, they update this Coordinated Services and Supports Plan, the CSSP, and then that waiver case manager sends all that documentation to the provider. So if you all feel like you just want to be a handoff, then in this case, if someone has that case manager role, you'd essentially either have them contact them. If you want to have more of an involved role, you could work with them to contact them and kind of help them get in contact with their case manager. But essentially, once that happens, the role is really on the waiver case manager to work through the documentation, get that sent to the transition or sustaining provider, and then once that's submitted, to actually be able to work with that person as a provider. If you want to be a provider, and this gets back to that question of, are they properties with services or are they external service providers? It would still be the role of whoever works there to get them in contact with their waiver case manager. Say you want to provide sustaining services, because really your goal is to keep people stably housed, to have tenants that can maintain these units. This is a really great fit, because what happens is you have staff who get in contact with their waiver case manager. They then determine that this person's eligible and that you are a sustaining service provider. That person says, yeah, I want to work with them at the property if you live. And so then you could also provide sustaining services for the person to keep them where they're living. You could bill for that. And another element of sustaining is once they're on, you can bill for actually getting in contact with them to renew that, to keep in contact with their waiver case manager so that the documentation gets sent through. So your responsibility, if you took that on as a sustaining provider, or if you're an external organization coming onto a property, is that you submit the documentation, and once it's found approved, that you can actually bill for those services. So that's, as you all think about the populations that are tenants, that's something to think about, is do they have some sort of targeted case manager, waiver case manager that we could direct them to make sure that they work through the types of documents they need for service. A second one is, we were talking so much today about housing support, is what might you do for someone who has housing support provider or is working or worker willing to help them. This one's a little more nuanced because the housing support provider could help that person find a qualified professional who could sign that. If they're already working with them and they already have that document available, maybe it's as simple as just updating that document to have our section for housing stabilization service filled out by that qualified professional, and then making sure, this is this kind of nuance, if the person has a case manager, then that support worker might be able to pass them on to the caseworker, or the case manager to complete the plan. If they don't, then they could refer them on to the housing consultant. And again, this is where overlapping revenue streams may really be helpful, because you could be enrolled as a housing support provider. You could also be enrolled as a housing consultant or transition sustaining provider, and you may be able to provide consultation services potentially for this person and be able to bill for that. You may be able to provide sustaining services and make sure that in that role they get connected to their waiver case manager. It's always important to think about the different ways that you may want to take on these services, or based on your capacity, you may want these services to be done by someone externally that you could then refer out to. So in this instance, if that person has a housing support provider, you could refer them to that provider who could work with them on working through this eligibility review process, and then actually start providing sustaining services in this case. So that's the two big options, or two scenarios. And when we originally thought about who would be serving on this program, the majority of our population are people who are either receiving waiver funded case management or are on housing support. The last population are really people who don't really have any help. They're not connected to any services yet. And this is, I think, where, as we were talking about what roles, site managers might play, or property managers, or people working directly as staff at properties, this is something I think that's very, has the capacity to be innovative and work into pre-existing processes or processes you all want to develop. And one of the things I really advocate for, that Jeremy very much brought up, is this is a service that can really help people who have not been connected to previous services before, and really support tenants that you may have that aren't utilizing services, but that will help keep them really stably housed. So I think for this scenario, I think this is something that's very malleable based on what property managers and developers and all of the processes are involved in how you work with tenants, that it can be adapted to each of your organizational needs. So this is me and our team kind of conceptualizing what it may look like, but this isn't defined or set in stone. It's very much, as I said, up to how you all want to figure out what a process should be. So potentially what could happen is, in the assessment process, that housing property staff could help find a qualified professional who could sign that professional statement of need. And as I referred to, there's a number of qualified professionals that, just in working with tenants, they may have referred to, or you have understanding or knowledge of, based on reasonable accommodations or other things, that documentation they may already have, that would cue you in and who should be contacted or do outreach. Or you may work with them to really get in contact with the county to see if they're eligible for waiver or targeted case management services. As Jeremy alluded to, it's really important to know geographically and locally, one, if they never have access to services, maybe they need to get a min-choices assessment and work through that to even see if they might be eligible for waiver services, or that you may need to work with them to figure out other types of housing-related services they may be eligible for, like MSA housing and or housing supports. So those are two ways we just kind of thought, what could your staff do if they're not doing that, if they're not providing housing stabilization? They just want to get someone connected to that. So you start with the county, they do an assessment, they may be eligible for waiver case management, and then that process starts. If not, the next step is really finding out who that consultant could be. So ideally, that property staff finds a qualified professional. They find their nurse practitioner they're working with, and that person goes to the nurse practitioner, they get their professional statement of needs signed. Now you still need a plan done. And if a person does not have a waiver case manager, they need to find a housing consultant in their area. We currently have a directory, so when I end the presentation today, I'll have some slides that have resources on them. I really want to advocate that we'll make sure we get these slides to you or access to the links as soon as possible so you can start looking through it. But what would happen is they'd find a consultant in the area, and that consultant could then come either to the property or the person could go see the consultant to complete the plan. The consultant then submits information, identifies who the provider would be, and then that's how that person would get kind of connected in to the system. And I think that's the population to think about most, is those who may not have ever had services or you might not be working with currently, who are very much eligible for our program. And the value of that is once they get connected to someone who can work with them regularly to keep stable housing, it really benefits you all because now you have a person who has their needs and supports met by having someone they can work with and who can bill for the time to really keep them in the properties that you all manage. So I'm going to end with some additional resources, some thinking creatively, and then I just want to leave it open to questions. It's about 2:20 and it goes till 3, so I'm going to try to get done by around 2:30ish and then leave questions for you all to answer before I conclude. So brainstorming with your service provider, some things to think about, and this is something I've kind of mentioned before, is who is going to be the consultants, who might be transition sustaining providers, what types of service they have, such as high priority homeless providers or designated disability unit providers. So think about strategically, if you're already providing some aspect of housing support, you may want to become a sustaining provider. But then if you become a sustaining provider, you also need to recognize, okay, then who is going to make sure that plan is done? Hey, we have a lot of people who have waiver funded case management. Well, that's really well, works really well because then their plan is being completed externally while the services are being provided and there's no conflict. So kind of thinking through what your organization might be able to take on versus what it might want to do based on the external providers you're already working with who are doing some of these services and maybe more well equipped to do that. Second, it's always thinking about how we combine services to really maximize the amount of available resources someone has. So thinking about how you might combine our service with the Minnesota Supplemental Aid Housing Assistance, which actually just increased as of July 1st of this year to $392. And it also expanded eligibility to people on or eligible for SSI relocating to the community from a housing support setting. So something to keep in mind is how you combine those resources. And then last but not least, as Jeremy really alluded to and has talked really nicely about, is how do we pair the service with housing support to really keep in mind that they work really well together. There's things that housing support does that housing stabilization doesn't do, and vice versa. And the more resources both the person has and providers have, it's just only going to be better for those people in terms of maintaining their housing. Okay, so this is just, again, much like the scenarios, like what are things we should consider or things, we thought about in coming to this meeting today is the property manager could be enrolled in housing stabilization services, but you need to enroll each site where you intend to provide sustaining services. So that's something to keep in mind when we talk about providers. Providers are agencies or organizations. So if you want to enroll and you have multiple sites where you might want to be a sustaining provider and try to keep people stably housed, it's just really important to remember that you would have to enroll each site. And there is an enrollment fee of approximately $582. So keeping that in mind if you have multiple sites where you would provide that. People still need to have choice. So you may have tenants who live on your property who may receive sustaining services from outside providers. Because that's their choice. They may want to work with someone in the area who is not you, and that's okay. And that it also can be vice versa. If they very much have trust with your organization because you're already doing other services, they may just decide to work with you. So you may have properties where you have sustaining service providers who are on site working with specific tenants, and then you may have people who have providers who are coming from off site. So just something to keep in mind. And then property managers may consider enrolling as housing consultants who could then refer tenants to external service providers for transition sustaining services. And that might work well. And again, I don't know the language, so site managers and property managers, I may need clarification on that. But what I mean is the agency or organization that is managing the property may find value in being able to complete that planning process. So they got connected to a qualified professional and signed that professional statement of need. There's the qualifications to be a housing consultant in terms of actual staff. You don't have to have licensure. You don't have to have additional education. Your staff just need to complete some training, some online trainings, and then they would be equipped to complete that person-centered plan, and you could bill for $174.22 per session that you do with a person. So that might be another value add if you have staff who are already kind of either fulfilling a role of working with people and getting documentation, or you have staff time that could be carved out to do that planning process and then would allow you to bill for it. So just some things that we thought of or things that we wanted to consider as we're working through how our service might really work well in relation to the audience we're talking to today. So these are the resources. And then once I get through the resources, I just want to make sure that we get to all the questions that have been answered. So there's a number of resources that we really advocate for as a way to really understand our program a little bit more. First and foremost is that policy page. We have so much information on the ins and outs of conflict of interest. On that provider page is the HCCBS settings requirements. So that's really important in terms of understanding some of the nuances of where people can actually locate to in the community. If you're interested in enrolling to become a housing stabilization service provider, the Minnesota Healthcare Program, NHCP Provider Manual, that is a really good resource that kind of walks you through the enrollment process. The NHCP Provider Directory is actually how you find out who is currently enrolled to provide housing stabilization services, and how you'd search as you go home and community-based services, and then you do subtype housing stabilization services. We have a frequently asked questions document that is updated monthly. It is on our policy page under the resources and training section, and it is up to 17 pages. And I know some of those questions around provider controlled and owned settings have been answered in there. So that's a really nice document that has a lot of answers to some more of the nuanced questions that we've got as we've gone out and presented throughout the state. We have a lot of we have some webinars and recordings. So we did a roadshow that has an extensive list of information for both providers and counties and tribes. As I've alluded to, that can be found under the HB 101 Benefits and Partners section. This slide is actually on that slideshow. So that's a quick way to get access to these resources. And then we've also posted some targeted case manager information for people who might be interested in the role of the targeted case management. Additional resources, we are huge proponents of HB 101. We think it is a very important and helpful tool. HB 101 not only houses information about our slides or our roadshows, it only houses information about our program specifically, and now there's actually a brochure that you can go on and print off, but it has so many tools that are just so good for housing providers in general, but specific to our program. So there's a number of paths people can use, including benefits lookup, budgeting, and just general information that helps you learn more about a person. It's a free service that you can also have a vault feature, which is pretty much an online storage and documentation system. So if you intend to become a provider or you know organizations that are, this is a really great way to store not only eligibility documentation and documentation about our program, but just about the person in general. And then what you can do is you can transmit that to other providers if you need to exchange information. And then last, there is a new Pro Tools that's called Keeping My Housing Plan, and it's really a guide for working with housing sustaining providers. So that's something to keep in mind. There's a person-served workflow. So again, if you went to eDocs repository and you typed in the person-served workflow, you would be able to find it there. And that workflow is just like a nice PDF with visuals that works you through person being eligible all the way down to how they can actually start working with the provider. And then last but not least, you can reach us anytime at DHS Housing Stabilization at state.mn.us. And we respond to emails pretty much daily. So any specific emails to our program, we can definitely enter in. So what I'm going to do is I'm going to conclude the presentation. And while I do that, I'm going to start entering in information into our chat box about the links that you may need right away, because I know they're not live. But I just want to answer Phoebe's question first. Then I'll start entering in URLs. And while I'm doing that, if there's any additional questions, I would be happy to answer them. But I'm going to do for now and later. Thank you so much for taking the time today to really get on the call and ask really good questions, and really, really appreciate the feedback about our program and our ability to present to you all. So thank you so much. So Phoebe asked, do providers need to enroll each facility and scattered site location or just property managers? So when you enroll as an organization. So if you are providing sustaining services to each scattered site location, you will need to do that. That's why there's multiple enrollments. If for some reason you're only working at one location, or there's a business location and you're not providing sustaining services to those sites, you would only need to enroll the facility or that business location. But if you are doing sustaining services at multiple scattered site locations, you'll need to do that for each location. So I hope that clarifies things, Phoebe. So I'm going to start putting in some of the URLs I think are really helpful. I'm going to stop presenting, but I'm going to give us another, why don't we start with the next 10 minutes if you want to put your questions in, and then we'll see how it goes from there. So thank you so much. And I just want to clarify that you all can see my links. So if anybody's still on the call, who's an attendee, can you just type in the chat that you can see these links I'm providing? Thanks, Jeremy. So good question, Nikki. Nikki asked, regarding registering for services for each location, if you manage a rental assistance program, example, bridges, how does that work? I think it's a really good question, Nikki. And I would ask that if you can send us an email to our housing stabilization inbox, we can work through that. That's something, Nikki, that as Gary and I were alluding to earlier, it's a little more nuanced. And before you enroll to become a provider, we really want to make sure it's clear what's expected, so there's no misunderstandings as you enroll in services. So I'll make sure we get that into the chat box too, that email address, so you can do that directly. So thanks for asking that question. And then can you clarify that housing stabilization service in general is duplicative for targeted case management, or just the specific housing consultation services within HCSS is duplicative of targeted case management? Great question, Amber. Yep, so it's only the housing consultation is duplicative. So again, if you have your targeted case management, you provide targeted case management, and you also want to do sustaining or transition services, that's totally fine. You just can't do them for the same person unless you meet that conflict of interest exception. So that's where that duplication would come in, is it's only duplicative of the consultation, but if it's for the same person, that's where that conflict comes in. So I hope that clarifies things for you, Amber. And if not, we have a little more time. So to the MHFA team, I don't have the option to select all audience in my send to. So if you could relay that to the audience, I'd really appreciate it. And then I just want to leave it open as our team enters the rest of the URLs for anybody else to ask questions. And that it's 2:35. Why don't we do maybe, let's spend 2 more minutes just fielding any questions and making sure we get all the URLs in, and then we'll conclude the meeting for today. And then Jeremy, did you want me to put your email up in the chat for people who are interested in TA with housing support?
Yeah, that's fine. Just the general, the DHS team box, because those are monitored and forwarded as needed. Do you have that one?
No, if you put it there. Sure. So Jeremy's going to give it, and then maybe our MHFA organizer team can put it in the chat. So go ahead, Jeremy.
Do it.
Okay, so yep, so we'll get it to the rest of the audience soon. And so is it dhs.dhs.grh or just one DHS, Jeremy?
No, both of them.
Oh, wow, it's so important. It needed to be twice.
Super clear, right?
Yeah. Okay, so we'll do 1 more minute for questions, then I'll just conclude the meeting. Okay, seeing no more questions, I'm going to conclude today's meeting. Thank you for all who are still in attendance, for coming on, asking questions, and just listening. Again, if you have any follow-up, we've put our contacts in the chat, and we also have the slides that are available in a number of places. Thank you all so much, and have a wonderful afternoon.